Thank you so much, Amarnath ji, for joining us on a podcast at Dawdle. As we start with all of the guests, if you could introduce yourself to our audience, your experience so far.
Sure. First of all, thank you for having me in this podcast, Rishikesh. Basically, I'm a healthcare professional. I'm assessed by profession, and then later on, I moved into the senior care industry. Was like I have an experience of around 13 years of experience in healthcare as well as in senior care. So I worked in a couple of startups related to senior care, where my was into the products and also into the e-commerce development for the senior care product.
Got it. This is a very interesting space, Amarnath ji. So, inside the senior care space, tell us a bit about what are the new technologies that are coming up, which is helping startups or organizations, streamline the senior care operations.
Absolutely. So thing is, if you're talking about the senior care, right? So in the senior care, there are various segments. One is the active senior living community. There is assisted living senior living, and there is a transition care, and also a palliative care. So we can divide the senior care into four major blocks. Okay. Currently in India, the active senior living is what booming up a lot. We can find a lot of players are coming into the active senior living. But similarly, we are seeing a lot of players are coming in the assisted living space also. To give a small example, like active senior is a person who's above 55 and is active, is mobile, he doesn't need anybody's support. For him, more it will be more of what kind of socialization he can have with this age group people. It's like-minded people. He can engage with them. So that is what his requirement is. Whereas in an assisted living facility, right, those are the seniors who need some kind of a help in their day-to-day thing. They might be kind of empty nesters, or they might have some kind of a physical disability or a chronic health condition. So some kind of an ADL, that is assisted daily living things they require. So those are the people who look out for the assisted living space. So in terms of transition care, let's say that somebody undergoes in a surgery, they need a setup as in a step down. Like once they come out of an hospital, right, they cannot immediately go to the house where they won't have all the facilities to take care of them. But in those space, we have something called transition care, where they can get recovered in a period of 3 months to 6 months. And the palliative is, as we know, that it is the end of the life care. Like when if a person is having a kind of a critical conditions where they cannot able to recover, we suggest the palliative care centers. Even the hospitals put them in the palliative care. So when you talk about the technology, right? So in terms of an active senior living community, right? We are seeing a lot of companies are looking out into the softwares for managing the residents, like how to engage their residents, right? So usually if we have a people, right, at the age of 60 or 65, they need some kind of an engagement to happen, the social activities or their day-to-day food requirement, or in case if they require any kind of an health issues, right, immediately they need some kind of attendance to attend that. So in those space, right, I can see a lot of new player software as SaaS based softwares are coming in to manage the entire community. So that is one thing I can see. And also, I can see that there are examples like Kubo Care or Dozy Care. They help in terms of remote health monitoring, right? You would have known that there is a lot of devices are coming in, which are contact or contactless devices to help the patients to monitor their the vitals every day. Because if they are staying in a hospital, it will become very expensive to monitor, manage them. But whereas in a senior care setup or an assisted living facility, these devices help them to manage their vitals, and immediately that reports can be shared with the doctors. Emergency or proactively, we can prevent any kind of untoward things are happening. So those are the new technologies that are coming up in the space.
And how is the market shaping up, Amarnathji? Like, if you talk about 10 years ago and now, senior elder care market has actually boomed a lot because we see a lot of startups coming in. Your viewpoints on that?
Absolutely. So when I started my career in this space, right, in 2013 or 2014, at that point, this was very, very nascent. Even people doesn't know that they were not aware that there is a home healthcare providers are there. There is a concierge service providers are there. Senior living communities are there. Over a period of time, that like last 10 years, I can see there is a gradual growth in terms of this awareness, and a lot of players are coming into the market trying to promote their services, products, and everything, so that people are also are getting aware. And importantly, the technology plays an important role, right? 10 years back, our social media exposure was very, very limited. Now, though, we have an like anybody can have the access towards the social media, like a Facebook or a Instagram. People, a lot of people engage with this kind of contents, and they understand that how important is to have a senior care facility or a senior care setup. So I think the market has grown drastically, I can say that. But still, if you compare the market report, right, we say that they say that the market penetration is only 1%. Overall penetration was only 1%. So that means there are remaining 99% untapped market is existing in India, Rishi.
Most of the time, Amarnathji, what I feel is that in the Indian culture, senior care was always the responsibility of the kids when they grow up.
Right,
Like they used to
right.
take care of their parents. Joint family was there, and parents were happily, kind of living with their. Do you think, the emergence of nuclear family or people coming into metro cities or people aping the Western culture, has kind of created this need of, senior care?
Absolutely, you're spot on. Actually, that's what I would put it across. Because considering the joint family structure is drastically reduced in terms of cities. Yes, still in tier two and tier three cities, we have that kind of culture and the social stigma attached to it. But when it comes to a city life, right? Like cost of living, like most of the people are earning a lot, but still, if you want to manage your parents in a city structure, right? It's very tough to manage in terms of financial aspects. So that is where most of the people think that either the parents should stay in their villages, or if they are coming, they need a separate space. So that is why, yes, the nuclearization is one of the key reasons that now the senior care industry is booming a lot. And also, one more thing I would like to add is that it's not only the nuclearization. Now there is a lot of migration, right? We can see in the from the south part, right? A lot of people are moving out of country due to their work or settlement or anything. They're moving out, so their parents are left over here. So individually, if they want to manage their parents, right, it is difficult. Like they are staying in another country, the parents are here. In case of any emergency, nobody is there to attend them. So that guilty conscious is also kicking. So that's why people are thinking, why not we put our parents in the this kind of active senior living. So this is completely different from the old age. Like we used to have a stigma towards the old age, right? We always feel that whenever we put our parents in the old age home, there is a stigma attached. Why the sons and daughters are not taking care. But now I can see that culture is drastically changing in cities. People are accepting the fact that they need the support and the socialization.
Yeah, absolutely. And in this aspect, Amarnathji, like, there's one thing, like inside, senior care is that the trained staff who can go on ground, who can visit these people and can take care of them, because a lot of, human angle
Resource
is
involved.
basically involved. How do, since you have worked inside these startups, how do you use to make sure that the training is done right? You are hiring the right people, and how did you use to source them?
Okay. So to be to be frank, I think in most of the cases, right, this market is a very unorganized and fragmented market. So there is no regulation or policy as such to regulate the entire structure. It is more like a fragmented. So there are like couple of organizations, they do it well. There are a lot of mom and shop kind of a setup that they have for a few people from the nearby villages. They train them for 2 days and they put them into the client places. I've come across a lot of issues, and still it is existing in last 10 years. The one thing that never changed is the this caregiver training setup. That none of the companies or the government level organizations have not put in a lot of structure in place. The structure is existing, but still it is not up to the ground reality. Like people are not experiencing the train the caregiver kind of a thing. They get the people, they train for 5 days, 7 days, and then put them into the client place. So I would put it like this. I think this is in a high time that some kind of like a well-known brands has to come into the market to do something towards this caregiver training setups.
So why do you think, sir, like well-known brands are not coming in the market in this segment?
Absolutely, the known reason is the attrition. Like the people who are working in the space, right? I would like we need to consider them also, that they're working kind of for, I won't call it as a, I would put it like it's in a, not in a good to do job, right? They are changing a diapers or taking care of a elderly who's a bedridden. There are a lot of strains involved in that. So anybody who comes into the space, right, over a period of time, within 3 months or 6 months, that the caregiver burnout comes in, that even though they
Yeah.
might be good, but still
Yes.
the patients may not behave well with the caregivers, or caregivers may not understand the patient's condition. So there is more of emotional things are involved. So that's the reason why many people come to the space and they move off immediately. And one more thing is that career growth. If anybody
Yeah.
wants to come and become a caregiver, right, what is the career path available? Hardly they can be only the caregivers to the max level. They can earn some 10,000, 15,000, or 20,000 max. So but now the case has changed. People have got a lot of options to move out. They can just do some deliveries and make 40,000, 50,000 easily. So they are thinking, why to choose this job? So I think some kind of a structure should come in place, and these caregivers should have a kind of a proper kind of like, they should get some the health insurance or some kind of a PF. So like these people should also be pampered enough so that they stay in the space for a longer time.
Yes. We have seen the example of Asha workers, Amarnath ji. Asha
Yes.
workers who usually used to come as a housewife and they used to devote 5, 6 hours daily, doing this, and it gave employment to a huge. Do you think, that is a right approach? That is, if you want to hire caregivers, you have to hire them from the community, pick up those people, especially the women, who may not be working right now, and, train them and engage them as caregivers.
I won't put it in that way, Rishi, because we have to change the norms. Like it is always, we expect that females are the caregiver thing. We always saw them in that space, and we, like in any family, who would be the care provider will be the female, at the female in the home, right? So we have seen that, but I think it is not a viable option. We need to have a properly trained male and female candidates, because here this involves a lot of understanding about the patient. It's not just to give bath, feed them, and to take them for the walk. That is not. It is just a basic thing. But if at all any patients who need an attender, right, there is a lot of things they need to understand as a geriatric care. Right? Geriatric care itself is a specialization where there is a lot of nuances involved in that. They should have the understanding what will an aged person think, how they will react, what will happen if something if they are not taking the medications, how some people may not take the food properly, how to feed them properly, how to be convincing them. So there are a lot of nitty-gritties involved in this thing. So I don't think so it is basic workers can do this thing. We need to step up, and we need to bring in a proper people, just like a nurse, right? How a nurse comes, she studies well, she knows what is the health condition, what are the physical condition, how to give an injection. They study and come to this work. Similarly, like a GDA, a geriatric care assistant, should also learn a basics about aged people, so that it will be easy for them to interact and communicate well with them.
Yes. That is so true, actually. And there is, one more thing that I wanted to ask is that how important is the partnership between hospitals and senior care, giving startups or organizations in terms of sharing of data, because data becomes very important in order to, understand what care is needed by what kind of seniors, what is their specific requirements like, and on the basis of that, you will be allotting the caregivers, if I'm right. So how important is this entire data analytics thing, especially when it comes to senior care, vertical?
Okay. Practically, if I want to tell you, the scenario is not like that. It is nowhere near to that. So the how the system works is completely different. So the patient will go to the hospital, get treated there, then they will get discharged.
Mm.
Either the hospital will have a tie-up with an home care people. They will say that they will give the card to the patient. So there is this one XYZ company is there. Just call them. They will arrange a caregiver for you. Okay. Then the patient calls the home healthcare provider. They give the basic details that the patient is having this kind of health condition. So can you just provide me a caregiver? So here comes the tricky part. Home health care. institute or the company, right? They need to go multiple surveys with an caregiver, like what kind of language you speak, what is the patient's health condition, what is the height and weight of the patient, and whether you wanted like a food preferences, vegetarian or not vegetarian, or I don't want this kind of people around me, or I want only this people. So there are a lot of questions are involved in terms of a home healthcare company before sending in one caregiver. And also, it is not sure that the people will accept the caregiver straight away. They will see 2 or 3 days. If they do, if they are not very comfortable, they will say that immediately change it. We need to bring another person. So in that way, I don't think so. The hospital and home healthcare setup really exchanges the data. So the data comes into the picture when we use the remote health monitoring solution. That is where we get more data than the practical association.
So, do you think there's a scope of improvement there? Like the hospital and the senior care thing has to be, aligned? Because I have seen a lot of real estate builders building assisted living concepts, like where they will have a hospital just adjacent to those flats, and those hospitals will also be, kind of caregivers to them.
Right. So to put it like that, yes, most of the active retirement communities, right, they wanted to build their active communities near to a hospital, like within a vicinity of 3 kilometers or 5 kilometers, right? So in case of any emergency, immediately the elderly person can be put into the hospital with an ambulance. So that is
Yeah.
the setup and arrangement they have. So that is much needed because in the active senior living communities, right? The hospitals can provide the GP for an 15 days once or a weekly once visit to the community, check their vitals, and give a prescription to them. So in that way, it makes the life easier for the seniors where they don't need to travel 10 kilometers or 15 kilometers to the city and get the checkups done. So now the scenarios is slightly changing.
And have you seen those real estate builders, taking it?
Yeah, absolutely. Absolutely, absolutely. Currently, I'm working with a couple of well-known players in the market in Bangalore market. I can tell you because Bangalore is one of the very hot market for the senior care, where a lot of active
Yes.
senior living communities are coming in. A lot of startups who are focusing on the seniors are coming in. So I've seen a lot of communities who like. There are a lot of options for the caregivers to choose. It's not that only one player is there. Whatever they offer, we have to opt for it. No, now the things have changed a lot. We are seeing multiple players in the market who are offering a similar solution. So the customer has the options to choose based on the preferences and what are the services they offer, what kind of medical care they provide. So now most of the players who focus on this senior care, right? They know that the healthcare is very it plays a very important role in terms of creating this community.
And how do these startups make money actually, Amarnathji? What is there? Like, is it a subscription based model or something like that?
No, so that is where I was telling, right? There are four different blocks altogether. One is active senior living that works as in the three ways. One is either it's outright sale or a lease model or a rental. So these three options have been given. In assisted living, it will be like you come and get a stay in my assisted living facility for a week's time or a 1 month's time or a 2 months time based on your recovery. You can come and stay and get discharged. In the transition care, works on the similar thing. Like they will take 3 months or 6 months recovery time and they get moved from transition care to the home. Yes, in the palliative care, monthly income that based on the monthly if I'm putting my parents there, like how much money I have to pay, like monthly 10K or 15K or for 30K, based on the condition, they charge it. So that's how the this space works. But when you're considering the service business, let's say that you're offering a concierge service, it can be like a packages, like the packages, like you will give multiple services in basic package, premium package, or diamond package, something like that. So they charge annually, quarterly, based on the preferences. They give a lot of options to the customers.
Yes. Do you see insurance companies covering all these charges right now in
No,
India?
no. Right now, it's not the case because insurance companies are feeling that this sector is a high risk sector. So they don't want it to really put in a lot of effort in this space. But still, I think in the future, a lot of insurance company will look into it. Like I would also suggest that insurance company can look into this space, because there are a lot of active senior living communities are there. Yes, we agree that above the age of 65 or 70, the risk profile is high. But if you look at it as a community, there are 100 seniors, means out of that 100 seniors, 20% might be in a high risk people. Another 80% are regular actively living seniors. So in that way, your risk proportion will be very less. So I think insurance companies can look into this space as a very like an untapped market.
Yes, yes. Or maybe, a kind of a partnership between the insurance companies, healthcare providers, and the caregivers.
Yes, it can be. It is possible. It is possible. But I would put it like more like, say that if there is a player called an Atulya or Columbia Asia Pacific, Columbia Pacific Communities, or any person to that matter, they can tie up with the insurance company saying that that I have an active senior living community where almost like 200 plus residents are there. Why don't you offer me a group insurance where the
Yes,
premium will be very less? The risk profile is low. At the same time, the premium can also be divided among those 200 people. So that, like we know that for the seniors, they need a lot of insurance support.
yes.
Everybody cannot afford an out-of-pocket expenses. So in this way, if the insurance companies looks into it, I think this is a great opportunity for them to give an like a good support to this senior care market.
Amanaji, would like to pick up your mind on a few things. Like, have you seen these startups or companies into this care, care market, senior
Hmm.
care market, use AR, VR, or e-learning or AI-driven skill assessments or training programs for their caregivers?
I think this is very early stage, I guess, because considering, as I mentioned earlier, right, the space is very fragmented and unorganized, where people are not trying to put a lot of efforts in terms of bringing an proper training setup. I think now the people are looking into it. Now the companies are also feeling that yes, the customers are expecting the highest service quality. So in that way, people are trying to see that, okay, what can I do for that? Can I bring in a good trainers, or can I do some kind of curriculum from the other markets or other
Yes.
well established players in the market? So yes, there are a lot of inputs are coming in, but still to materialize, I think it will take another couple of years to see that. Like on ground, we can see that in a couple of years, we can see the change.
Yes. So, sir, you have also been into the hospital, kind of setups as well, and you understand how hospital procurement works. Would you like
Right.
to throw some light on how does the procurement function inside hospital works, and what are the modernist technologies that they have started using or they will be open to use, which can help them in the procurement part?
I won't point only towards the kind of what is that logistics part of the
Yes.
procurement part. Sorry, I think I missed it. So I won't specifically mention as a procurement thing, but overall, in a hospital
Yes.
setup, right? You still in every hospitals are struggling to retain their staffs due to the high attrition rate, or like the nurses are the backbone of an hospital, right? 60 to 70% of the populations are nurses. Now you know that after 2 3 years, right, now feeling that they can move to the other countries for an better better positions and better salary packages, right? So in that way, the hospitals are also struggling to retain their staffs. So in that way, I think it's a high time the hospitals has to look into the technology support, where they can see that they can use a lot of SaaS based platforms in terms of their like, even though they have a limited staffs, right, they're using the technology can enhance the productivity. At the same time, it will reduce the burden of work burden also. Let's say that if somebody's putting in a remote monitoring solution in an department, if you need 13 nurses to take care of 100 patients, here it will be very reversal. Even within 15 nurses, you can manage the 100 patients, because you know this devices will give an emergency alert, or any case of something goes wrong, immediately the nurse will get an alert saying that patient is having an issue. So immediately they can run and handle it. So in that way, the efficiency and the productivity will increase, and the workload of the staffs will also reduce. So I think in that way we can implement the technology. And similarly, in terms of pharmaceutical, right? In terms of we can procure it in a Like right now, the procurement part is also like it is not going to be in a cumbersome process anymore. Like there are a lot of like vendors as well as the hospital staff, right? They have the similar softwares to create the invoices or generate the delivery bills or everything. So it is easier now compared to the few years back, right? Now the entire system is getting changed right now. So that goes with all the departments in the hospital. Even in the insurance claim process, we can see a lot of startups are coming and saying that we will be your TPA. You need not to worry about your insurance part. We will help you right from the admission till they're getting discharged and the payment
Yes.
receipt. So a lot of changes are happening. I think it's a. I would suggest the hospitals to invest in the technologies so that it helps them in the longer run.
Yes, but what we see, we hear from a lot of startups is that hospitals are not open to exploring the new technologies in India specifically. What
Ye-
might be the reasons for that?
Absolutely, the reason is that the hospitals, like, they calculate based on the budget, right? If I'm going to invest like a 5 lakh or 10 lakh rupees, how much I'm going to get the return on that?
Hmm, hmm.
Rather than investing 10 lakh, I can say that within that 5 lakh, I can hire another 10 people and get the work done. So that is the mindset most of the hospitals are having, that they don't want to invest much in it. But I think this is going to change over a period of time, considering now a lot of AIs are coming into the picture, right? So technologies are coming in, the even now the patient care has become a kind of a, how to say, a luxury service. Anymore, it is not an a service; it is more of a luxury service. Every patient requires that they need to be treated with an kind of like they need to be pampered, right? They're saying that right from my admission level till my discharge, I should not face any issues. Like that is how the people are also choosing the chain of hospitals, like you name it, any well-known brands in the market, right? They offer this healthcare services as an luxury offer, luxury service.
Yes. Now coming back to the senior care, segment, Amarnathji, like where do you see the maximum growth happening right now? Tier two, tier three cities or the metros?
Metros. Even as I mentioned earlier, right? Penetration in the metro itself is 1%. So I think there is a huge potential in every city. So recently we were doing a market study, like where would be the high growth will happen in terms of senior care market. So most of the market study says that it is like 60% of the senior care market is potential is in south side. You name it, whether it is in Karnataka or Kerala or Andhra Pradesh or Hyderabad, because due to the infrastructure, healthcare setups, and also the companies. So here the affordability is more. There
Yes.
a lot of startups are coming and a lot of the builders are coming into the space, considering the potential is there. Affordability is also there.
Yes, absolutely. Affordability is there. The per capita income is high, and
Yes,
people can afford. Second thing
absolutely.
I would also tell is that in south part of India there is more more culture of taking care of your parents, because
Yes, yes.
still you will find a lot of South Indian families, they have a joint family, so that connection is still there as compared to what you see in North India.
Yeah, I would say it's a vice versa. Because when yeah, so because when I was doing this market study, right, I saw this four states are having high nuclear families compared to the north. That's the reason why, when if there is a more joint family, right, you don't need an active senior living community. People themselves will be there taken care by the kids or the nephews or in and around.
This was very insightful, sir. I think we touched upon a lot of things on senior care, and you have explained it very well to our audience.